Today is the first ever National Fentanyl Awareness Day, and you may have heard a lot of things about fentanyl that made you wonder, is that really true? But those same fears may be stopping people from helping others when their lives could be on the line. And it's time to dispel those myths. Earlier today, I sat down with an expert to give us the facts about fentanyl. And joining us now is Dr. Ryan Marino, MD, emergency physician, medical toxicologist, and addiction specialist. Ryan, thank you for being here to talk about Fentanyl Awareness Day with us. First of all, can you explain more about what this day represents?
Yeah, so I think most people are aware at this point that we have an issue with overdose deaths in this country and have for quite some time. And I think most people are aware that this is predominantly due to fentanyl. But what we're seeing is that this keeps getting worse year on year. And so the point of Fentanyl Awareness Day is to try to bring more awareness and get people better educated so they know that fentanyl isn't just something for everyone to be scared of, but it is something that we should all be aware of and be better educated on.
Sure. And speaking of awareness, there are many questions and in some cases misconceptions about fentanyl. Let's talk about some of the biggest ones, like can you absorb fentanyl powder through your skin or even the air?
So for all intents and purposes, no. The drugs that are sold on the street come in the dry, solid powder form. This does not readily absorb through the skin in any meaningful amount. It's not something that you can just be exposed to accidentally. It doesn't get into the air on its own. So the big risk is for people who are using drugs. And so people who probably don't know they're getting fentanyl, and fentanyl is showing up now in things that are being sold as like a Xanax, as Adderall. It's showing up in cocaine and in amphetamines and causing overdoses in that way as well. So that's the main concern. But it isn't something that everyone needs to just be worried about leaving their house, touching things on the street. It doesn't work like that.
I often hear about powerful synthetic opioids. Do these pose any dangers to police or EMTs or anybody who may be treating someone who's experiencing an overdose from fentanyl?
So our first responders are kind of one of the most important, if not the most important part of the response to our overdose crisis. And I want them to know that they are not at risk from a scene with these drugs present. Certainly there's plenty of other things that they have to worry about, but it's not something that, again, you can accidentally overdose on just by touching someone who is using drugs or being around drugs.
What are some symptoms of overdose that everybody should be aware of?
So the main thing to watch for would be kind of a depressed level of consciousness, so someone who is less responsive, and certainly the primary feature of a fentanyl overdose or other opioids like fentanyl would be a lack of breathing or very slow, shallow breathing.
And are there any other myths that need debunking that you can think of?
I think the kind of education and knowledge of drugs is always something that there's room to improve on. But we use fentanyl every day in the hospital. It's one of the most used medical drugs, and it is a wonderful therapeutic medication that is invaluable to every hospital healthcare system around the world, 24/7, 365. So again, it can be used safely. It's not inherently bad or dangerous, but when it shows up in places where it's not supposed to be, with someone who didn't want to get it in doses that people don't know what they're getting, that's when we see problems. And that's why tens of thousands of Americans are dying every year from fentanyl.
Sure. Well, that's all the time we have. Dr. Marino, thank you for being here with us. We appreciate it.
Yeah, thank you.